It would be the year that changed everything. The year when an invisible enemy destroyed lives and livelihoods, disrupted our way of life, and our sense of stability. But crisis can also be catalyst for positive change. As 2020 draws to a close, Singaporeans look back at how they adapted, invented, and innovated to overcome the scourge of the COVID-19 pandemic. It was just days after Christmas when reports of a mystery illness surfaced.
A mysterious respiratory illness with
Nearly
similar
300 confirmed cases are at hospitals like this one here.
Mysterious illness continues to spread across China, and this evening, Taiwan confirmed its first case of the virus.
I remember I was in the operating room and I was with my bosses and fellow surgeons. We were operating, and someone mentioned this. And one of my mentors actually said, you know, we need this thing can either be controlled immediately, or we all really need to be careful because it can go crazy like what happened in SARS. To be honest, I actually laughed it out because you didn't really know the seriousness of it at that point in time. But it got a lot more worrying after the next few months. That's when the numbers started coming up, and worldwide and all.
Reena Dharmawan is a cancer surgeon with a background in bioengineering.
So when COVID, the pandemic hit, what happened was that us specialists were sent to the front lines to do the nasopharyngeal swabs. When you're doing the swabs, right, the most uncomfortable thing is that you have to wear full PPE throughout the duration that you're on. And that means wearing the N95 for long hours, wearing the yellow personal protective, which is very hot. So having to do that for long hours and having to do multiple swabs, and the worry that you are exposed to patients who are potentially COVID positive was very worrying. In the back of my mind, very worried about exposing my family members who I have to meet every day to the virus.
Out of that very real fear came a solution, Swabot, an idea hatched from a collaboration between Reena and a local startup. BioBot makes robots for the biomedical industry.
Okay, hi everyone, thanks for joining. Brainstormed a possible solution, solve the swabbing problem. We were having this discussion about why not we automate this process? The vision was really, for example, when you actually go to the optometrist to get your eye checked, where you actually fix your head into the machine to check your eye. So you put your head there and your eyes get checked. So why couldn't we create something that does that exactly for nasopharyngeal swabs?
So when we were first approached with the idea of Swabot, there was some surprise because we were wondering why you would need a robot for a simple swabbing procedure. But I think as we understood more about the project, we identified that there's really a value proposition for it.
Collaborations like these don't happen by accident, nor are the networks that nurture them built overnight. Since the 80s, the city has been investing billions on building a pipeline for ideas and bringing them to market.
You want to have an ecosystem where there's smart money, which means it's not just a matter of investors giving you spare cash, but investors who understand technology, who understand networks, and are able to equip and empower and expand the networks of innovators in Singapore.
All smooth surfaces. Here we have the swab guide with the slot.
So I'm concerned on the fingers touching the swab stem.
But the payoffs for such investments, the patterns and profits usually require patience. and years of slogging past setbacks. What this pandemic may have inadvertently done, however, is accelerate the process. By mid-April 2020, almost daily three-digit increases in COVID-19 cases made the headlines. Many of these came from the close confines of migrant worker dormitories. More testing was needed, and this meant even more pressure on an already tedious, time-consuming process. A solution was sought.
I actually got a call from my boss to say, hey, we need to do a lot more testing. What can we do in automation? Hello.
David Lowe leads a team at A-STAR, the Agency for Science, Technology and Research. They quickly hit the ground running to build a robotic solution.
Essentially, when one do a COVID testing, now is a nasal testing commonly used. The swab will be placed into a plastic test tube. What happens now is it goes to a lab, the barcode gets scanned, and then the tube needs to be uncapped, and then one will need to pipette the liquid from the test tube to various channels, and then recap it back. So all these are very laborious. What it means is that many people are involved to do this physically, wearing PPE, personal protective equipment. It is very challenging.
So we have two robots, so one robot doing the capping and uncapping.
With concept in hand, they roped in a partner from the private sector, Japanese robotics manufacturer Sankei Eagle. Raymond Siu is running point on the project here, codenamed Rave.
Usually, we will have a project, for example, 8 to 12 weeks delivery. But for Rave, we have to work extra effort and in a very fast pace to deliver within 6 weeks.
The Rave team is building an automated pipetting machine. It transfers test samples from one tube into another before they undergo a polymerized chain reaction test, the most common way to test patients for COVID-19. If successful, this robot will work 10 times faster than a human, with a lower margin of error. With COVID infections rising around the world, the team works against the clock to build a prototype. Meanwhile, in a workshop across the island, Dr. Rina Darmawan's idea to automate the swabbing of patients has taken shape.
It was literally only 6 weeks since we first met. It was literally like what we envisioned came to life. I think it's more bio-friendly.
What makes Swabot effective is that it can be operated by almost anybody, including the patients themselves.
This is great. It's amazing that you guys came out with it in such a short period of time. So that is very exciting. Where you fix your head into a machine, the swab does the swab, and then it goes. That way, you don't have to, number one, expose the healthcare worker to patients who are potentially COVID positive. Number two, the healthcare workers who are sent to the front lines to do it could potentially be doing more important clinical work.
Swabot has yet to be rolled out in hospitals, but the prototype already looks like a game changer for healthcare.
We heard from the clinicians that the response from the patients was quite overwhelming in that they found the robot much more comfortable than manual swabs. And I think that was really encouraging. Then again, we know that there's still some way to go, and only if it's deployed in more places, then it would really be creating an impact.
Back at Sankei Eagle, the pipetting robot project, which started in April 2020, is finally deployed at COVID testing labs.
I think throughout Singapore, the entire ecosystem has been working very closely in fighting COVID-19, whether it's public or private.
I would say we are now in a more nuanced position. that we need to have some in-house capability. We need to have our fair share of hardcore engineers. It helps inform our policy making. It helps inform us on the trends for the future. And at the same time, this enables us to build a more effective partnership with the private sector.
Such public-private sector partnerships have created a vibrant tech sector in Singapore, driven not by maverick startups alone. Some older SMEs are also reimagining their businesses to make the most of new technologies and trends. In the 1980s, PBA was a bearings distributor. But when Derek Yap took over his family's business 10 years ago, he switched gears and started building robots.
We wanted to move away from inventory, stockist, low value-add business to something higher value-add.
PBA became a pioneer in homegrown robotics manufacturing. But COVID-19 slammed the brakes on the company's growth.
Around that time, actually, a lot of businesses were starting to get affected. We have customers who delayed projects. We have opportunities and discussions that were pushed back or cancelled.
This crisis, however, also presented possibilities. Since the outbreak, the work of cleaning and disinfecting public areas to curb the spread of the virus became a high-order task. Terence saw opportunity in this now essential activity.
The way I see it, first reason is you want to automate something that is repetitive. The second one is you want to carry out tasks that might be dangerous for humans. So the way we see it is that this is actually the ideal case for automation to come in.
PBA's design team used one of their existing robots, typically used for fetching parts or packages at factories or warehouses.
So guys, I recently received a couple of feedback from the customer. They were asking if there's anything we can do to keep people away when the UV lamp is in operation.
This was retrofitted with a high-powered ultraviolet light able to neutralize bacteria and the coronavirus.
Our Sunburst UV disinfection robot, it comes with 4 sets of safety features.
Known as the Sunburst UV Bot, it's now on night duty at North Point Shopping Mall. In 2 hours, a pair of robots can cover what, during opening hours, are the most crowded areas here. Following positive reviews from the mall, PBA expects more of these robots to be on cleaning duty in other high foot traffic areas across the island.
As the saying goes, adversity breeds innovation, right? So I think that there's no better time than now to step up and create new ideas, solve problems. And I think we talk about not just getting past the virus itself, but about the post-COVID world, how we're going to recover, how is the economy going to pick up. I think by working together, definitely we'll be well positioned in the future ahead.
After an 8-week lockdown, the circuit breaker is lifted and Singapore is gradually opening up. But with fears of a COVID-19 resurgence always present, moving forward is attempted with precautions, including one that would put the public's trust to the test. February 2020. A little under a month since the first case of COVID-19 in Singapore. Clusters of local transmissions begin to emerge.
From scanning QR codes to identity cards, this is the new normal for shopping. At this mall in Woodlands,
safety measures are enhanced across the city, with temperature checks becoming a daily routine. Meanwhile, these engineers are midway through experiments on a new tool to help speed up the process.
Using this robot, we can test it almost.
We first conceived of iThermal back when Singapore was under DORSCON yellow. We anticipated that there might be a need for some of these thermal screening systems.
iThermo is a computerized temperature screening device.
Okay.
Gerard Chew is lead engineer. When the outbreak hit Singapore, he began work on a device that could spot fevers in a crowd from a distance as people entered buildings. It also had to work practically anywhere.
We found that a lot of these devices tended to occupy a lot of space. This may not have been conducive for the kind of environments where we envisage iThermal being deployed.
iThermo had to be smaller and budget-friendly. Consumer technology like smartphones, laptops, and digital cameras would make this possible, as would the use of artificial intelligence.
Basically, the AI looks for a person's forehead, and then after that, we would use AI to exclude the lower half of that person and find only the upper half, which is the forehead area. And once we had that, we would then zero in on the temperature.
Basically, you can see there's a lot of thermal noise from many sources, whether it's from
The IHIS team had just 2 weeks to develop their idea and present a proof of concept. While elsewhere on the island, another team were at the final stages of development for a new app. Since the beginning of the outbreak, engineers here have been designing digital platforms to provide the public with important and timely information, like where to pick up masks and the locations of designated clinics for suspected COVID cases. But these GovTech engineers had another innovation in the pipeline, an app to help with the complex process of contact tracing, and therefore also help break and dampen the transmission of COVID-19 infections.
The circuit breaker, it created space between us, safe distancing. It slowed down the transmission between people who were infected and the people at risk. And the reason we had to do that for our whole country is because we didn't know where the disease was. We didn't know who was at risk. What this sort of transformation of contact tracing will allow if we do have a very high penetration. Mini circuit breakers, if you are positive, then just for the people in your immediate circle of friends and your network, they have to go through a circuit breaker, but not the whole country. And that will allow life to go on as we have to find ways of living with COVID-19.
Trace Together was this transformation of contact tracing. It uses Bluetooth on smartphones to clock who's been in close proximity to whom. Should someone be diagnosed with COVID-19, this information would help health authorities trace and alert anyone who has, knowingly or unknowingly, been in close contact with a patient. But version 1 of Trace Together didn't altogether get off to a great start.
The thing is that not all phones are the same. You got Android, you got Apple. Two different ecosystems. The funny thing is that we had to go out there and buy like 40 or 50 phones, and we had to test for every single kind of phones, right? Because they're not exactly the same. The problem is that the moment you keep your phone or you swipe up the app, it could go in the background. So it became not as effective. It was a very rocky journey. It started with a minimal viable product, and then we keep improving it literally week by week.
As the GovTech team went back to the drawing board,
It's very hard for us to tell who in this group here has got a fever, and especially
Gerard and his IHIS team presented the proof of concept for their temperature screening tool, iThermo. To build it, they tapped on existing technology, a device that helps nurses examine wounds, a product made by their startup partner, Chronic Care.
It had been recalibrated and the software changed in order to convert it into a thermal scanner. So for example, the wound scanner used a very small screen display, but some of the clients asked for larger screens, so we switched to a tablet display.
iThermo is currently being used in schools, stadiums, shopping centres, and other high foot traffic areas across the island. By being able to identify fevers in a crowd, even when no one's looking, iThermo is able to minimize human error.
It has allowed a lot of mass screening to take place in locations that traditionally would not be supported by mass fever screening systems. The gantry system that we are putting in place right now allows us to control turnstiles. And if, for example, if you had a fever or detected that you had a high temperature, that's when it will actually send an alert and prevent the gantry from opening.
Just as one system bars entry to a person with a fever, another identifies the places that person has previously visited. Safe Entry, Singapore's national check-in system, which was introduced in April 2020, helps health authorities address a critical question that COVID patients often have trouble answering. Where have you been over the past week?
When they check in, the data is just stored. What it does is that then it allows us to go in there and see what location the person has gone through and try to figure out what's the risk associated with those locations and the people around there.
But knowing where a COVID patient has been is just one part of a successful contact tracing system. Knowing who that patient's been in close contact with is the other. Enter the new and improved, now debugged, Trace Together in September 2020. This time in two versions, a smartphone app and a physical pocket-sized token.
We had to cater for a segment of the population that either doesn't have a phone or are not comfortable in using the phone or the apps on the phone. So we came up with the idea that the similar protocol can be implemented on a small device. There's no switch, there's no button, nothing except a flashing light. We wanted to make sure that it's very inclusive and people don't need to learn how to use it. Just carry it.
But while the technology was ready, the public needed to be convinced to buy in. A robust debate about personal privacy emerged. To date, nearly 55,000 people have signed an online petition protesting the use of such a device.
There was anxiety. Thousands of people signed a petition. I was actually glad. I was glad that they cared enough about the issue, expressed their concerns, and it also provided an opportunity for us to address those concerns and to do things in an open way.
To help people understand exactly how the token works, several public engagement sessions were held. Roland Turner was part of a focus group assembled to examine the token in minute detail. Turner is an expert at software and network engineering, and his focus is on internet privacy.
So the session allowed the four of us to determine with confidence that the token only contained the things that it needed to do its job. And in particular, there was no GPS receiver, there was no mobile network module, there was no Wi-Fi receiver. The things that give rise to the kinds of tracking risks that people are worried about. The information that it collects never leaves the device or the token. The data that's retained on the phone or the token is only retained for 25 days in the first place, which is about what's useful for contact tracers. Anything beyond that is purged. Even if parties outside government decide to try to use it as some kind of surveillance or tracking system, they can't.
2 months after the national distribution of the tokens began, the adoption rate for Trace Together in Singapore's population crossed the 50% mark. That's more than 2.5 million people, app and token users combined.
To reach to a level of real efficient contact tracing, we need about 70% of the population to adopt this ecosystem. If they can interact with us, then I think the ecosystem becomes more and more complete. I think that's really our objective going forward.
In April 2020, Singapore's Blue Trace protocol, the software behind Trace Together, was open-sourced.
What we want is for systems to work and for the benefits to be spread throughout society. And having government products or innovative services open source wherever possible allows us to work with the private sector far more effectively.
As of December 2020, The code that runs Trace Together has been adopted by Australia and is currently being studied by over 50 countries.
Singapore has something of an edge in developing and deploying innovative technology, in part because of the preparatory work over the last 10 to 15 years. Singapore can no longer thrive by importing innovation, but must instead be able to develop and export it. This has meant that unexpectedly a gigantic crisis arrives. The tool set, the skills, and the willingness to experiment and do unusual things in order to address an unprecedented problem.
April 2020. Singapore is on lockdown. Called the circuit breaker here, this was a drastic step taken to help curb COVID-19 transmissions. Businesses, government offices, and schools were shut or staffed by skeleton teams. But life and education needed to go on.
Singapore schools from primary to junior college levels will conduct 1 day of home-based learning a week starting April as the COVID-19 pandemic worsens.
Home-based learning isn't new in Singapore. After the SARS experience, it was introduced with some regularity. A couple of days a year set aside for students to attend classes from home. The COVID-19 circuit breaker would shift home-based learning into high gear very quickly. Stanley Han is the father of a 9-year-old and the founder of a math learning portal for school children. Qubits was launched in 2014, long before the COVID-19 virus landed on Singapore's shores. Already a popular online tool for learning, the circuit breaker would see a doubling of users to 30,000 a day.
On Qubits platform, we have a lot of activities meant to engage the children by themselves rather than with teachers' specific instructions. We believe that is really helpful to teachers because during the lockdown, the teachers are extremely busy. They have to plan lessons and they have to deliver those lessons online, and they have to do all these things across a simple computer camera.
The transition from brick-and-mortar classrooms to virtual space of the internet wasn't without problems. There were teething pains and adjustments to be made by educators, students, and their families. But working in its favor was the island's push towards becoming a smart, connected nation. Qubits is one of many platforms that allow teachers to keep their students learning amid disruptions caused by the pandemic.
We had a head start. Not just the first 6 years of the Smart Nation journey, but in fact, the decades of computerization in Singapore. Pervasive fiber broadband to every home and every office was in place. A very responsive 4G mobile wireless system was in place. We have an average of 1.5 smartphones per person in Singapore, which is obviously one of the highest rates in the world. Our young people are what I would say are digital natives, which means they're born with digital tools.
Education isn't the only sector that has leveraged technology to its advantage in pandemic times. Almost everyone who could jumped on the digital bandwagon to keep the wheels of their business going.
So what COVID has done to catalyse this is simply to present an enormous crisis without notice that needed very substantial measures to address. And so it was all these existing skills and technologies and infrastructure and even attitude changes to be more hands-on about applying technology to solve problems rather than look for problems for technology to solve. And COVID has given us an enormous set of these problems to solve at no notice and at enormous speed.
Unfortunately, not everyone is born a digital native. For some, all this new technology is an alien experience. They needed help. And who better to help them navigate this strange new app-driven world than those who were once in their shoes? Enter an army of smart nation and digital ambassadors.
They are people who are largely older folk who may have themselves been brought along this journey by a friend or a family or a co-worker. Now they understand the benefits and they want to spread that word to their friends, family, but also to people of their generation. So having people who have struggled with that adaptation, learned, they are the best ambassadors to convince the rest of Singapore to come on board and be digitally included.
If I want to go out, I have to...
You have to check out, yes. You have to check out.
Retired lecturer Ong Chin Tiong is 61, and he's smartphone savvy. His children and his students have been showing him how over the last 10 years.
When you download, the app must be to the latest version because this one follows the latest version.
Now he's using his free time to pay the favor forward by helping his peers make sense of different apps and e-services.
Some of them treat us as insurance salesmen, some of them avoid us like leeches. Yeah. So you have to get their attention very fast. Basically relate your story of how you get on board to learn your digital journey. You key in your postal code, then it will show you which CC to collect. The challenges, some of them that I face is they are so lost on their handphone. So you have to be very patient to guide them, including page by page. If they want to explore more, then it's a bit difficult for them to do alone. So if you have the guiding hands there, then the confidence level is higher.
The pandemic pushed Singaporeans to adopt technology like never before. It also turned regular Singaporeans into serial inventors. Hairil Rizal Abdullah is an anesthesiologist at the Singapore General Hospital.
We'll start to prep you up, put up all the monitors, okay? And I'll see you in a while, yeah?
When the pandemic hit, Hairil wanted to help his hospital and others in the city be better equipped to deal with COVID cases. Together with his colleagues, Hairil came up with a trio of inventions to help make vital hospital services safer for medical staff during the pandemic. One of them was a mobile swab booth, which took minutes to set up. The idea was born not out of a hackathon or incubator, but over coffee.
One of us, I think, just mentioned that, hey, maybe we can have like a barrier device. And then another said, yeah, a barrier device with gloves. And then somebody else, chip in and said, yeah, this barrier device should be, full length with a top so that when somebody sneezes and coughs, it won't go in. And it's just, it builds up like that. And I think from that experience, we learned that we can quickly innovate things. We can have something like SG Safe, a booth like that. And
this first invention inspired the second, an isolation room for X-rays. And completing the hat trick, their third big idea.
Singapore researchers have developed a portable system that can convert wards and ICUs into isolation rooms.
SG Spark is a double negative pressure airlock chamber. The technology itself is not new. It's typically used in isolation wards to trap and filter contaminated air. But not every hospital has such facilities. SG Spark's portability is the game changer.
So, SG Spark actually can be fitted into most rooms, okay? Not just the ICU and not just the operating theatre, even though these are the initial intent of SG Spark. And as we develop the product, we realized that it can also be retrofitted to ward area. For example, a general ward area where you want to isolate that particular ward from the rest of the environment. You can also retrofit that into a procedure room in clinics where you do simple procedures like dental procedures or lung procedures, bronchoscopies and things like that.
SG Sparks allows hospitals anywhere in the world to convert ordinary rooms or operating theatres into isolation wards at half the price and in half the time.
You've heard of the SG Spark, right? If you spend 100% of your time, 100% of your resource fighting fire, you will not have time to sit down and think, how can we improve things? In SGH, if you have an idea, all right, if you want to do something, you will be given the support, the time needed. And I think that really, really helped. I don't think there's anything nice about COVID. It has claimed a lot of lives. It has upended a lot of people's livelihood. But at the same time, I am thankful that we had the opportunity to contribute on what we can and how to control, at least mitigate the impact of this disease.
Yeah, let's have a look at your area.
Disaster Outbreak Response Systems condition, otherwise known as DORSCON, was changed from yellow to orange.
Singapore is at DORSCON Orange. Moments after the announcement, scenes of panic play out across the country. Staples like eggs, rice and noodles fly off supermarket shelves faster than they can be replaced. Purchase caps are imposed on shoppers to prevent hoarding.
NTUC Fair Price has tripled the volume of supplies to stores a day after demand for essentials surged by about 5 times.
Even in its early stages, the pandemic exposed Singapore's long-standing vulnerability, its reliance on supply chains. More than 80% of the country's food supply comes from overseas.
This COVID-19 is a very big wake-up call for Singapore. It actually acts as a catalyst for Singapore to realize the importance of food security and to actually speed up our activities in terms of producing more food for the nation.
Alfred Tam runs Indoor Farming Factory Innovation, or IFI. This is a homegrown company building robots and other equipment used in the growing indoor farming industry. The COVID-19 pandemic, however, made Alfred think beyond just robots. Motivated not only by potential profits, but by a desire to contribute to Singapore's food security, Alfred has gone into indoor farming himself.
Singapore is a small country, all right, so with land scarce. All right, so in order to overcome this food security issue, we really need to look at, farming in a smaller space with a higher produce. So that's why right now we're actually in full swing, all right, to set up our indoor farm, whereby it is targeted to churn out about 800 to 1,000 kgs per day. And I believe that this is will be a huge contribution, all right, towards the Singapore food sustainability.
Alfred is customizing his technology and making plans to install it in his mega indoor vegetable farm.
We actually do a lot of analysis, data collections, and then to actually program the robots to perform those processes in the farm, to actually overcome those very manual processes that is currently performed by human.
While Alfred sows the seeds for more resilient food supplies in Singapore, another local SME embraces innovation to make its fulfillment process even more efficient. Redmart is Singapore's largest online supermarket. It carries 100,000 products and makes deliveries across the country every day, all year round. This is its warehouse. Before the pandemic, pickers pushed trolleys across different zones to collect ordered items. That labor-intensive process has now been automated.
And then push it back in so that we go to
Logistics Chief Gerald Glowett helped design this new system.
In Redmart, we sell products across 5 temperature zones. The automation process happens within each of these zones, where basically the pickers stand in one area, so we call that pick to light, and then the totes travel on a conveyor belt, and when they reach the certain picker, the tote would stop, the picker would see the light flashing up where the goods are stored in the shelf, and that lets the picker know which item to grab and put inside the tote, and then they push it back on the conveyor and it travels to the next area where a different picker would pick the next item for that specific customer order. When that is completed, the entire order basically gets consolidated and gets shipped to a little facility across the city.
Redmart had been planning such a system even before the pandemic, in anticipation of a rise in online shopping among Singaporeans. The pandemic inadvertently fast-tracked the process. In April, Redmart's warehouse was choked with orders. Software had to be designed and hardware installed in a hurry.
It started with the panic buys. People were just hoarding food. But then after that, we just saw a shift in customer behavior. People, I think, just adopted much quicker to shopping online, which was, to be honest, quite challenging for us because the demand uptake happened in a few days. We had to quickly adopt our processes to meet that demand. On the software side, we were able to do a few changes within 2 days. And that actually helped us quite a bit to overcome the shortages and to basically manage the sudden spikes of demand that we could see during the lockdown and the circuit breaker period.
It's been 6 months since circuit breaker measures were lifted. Yet the number of daily orders remains high. It's now double what it was a year ago. Redmart has kept up with the surge in orders by boosting productivity by a factor of 3. But as COVID-19 continues to push more businesses into online retail, the company recognizes that it must continue innovating to stay ahead of the curve.
If there's more competition, that just means that everyone needs to improve their processes and their offering to the consumers. When it comes to software changes, the way that we organize the stock in the warehouse, that is always changing. The way that we develop our app, offer different shipping options to customers, and so on, that is constantly evolving.
So, as mentioned earlier, just now, because for this portion, I think...
Adapting one's operations and cashing in on new opportunities is something that Alfred knows a little about. Now he has help in the form of funding. In September this year, his company secured a sizable grant from the Singapore Food Agency to invest in innovation. Alfred intends to spend it on artificial intelligence and R&D.
For i5, we are not just a farm. We are actually a farm out of the box. Why do I say that? It's because we not only produce the crops itself, we also design and manufacture a system to actually grow the crops. Then, of course, we did a lot of research to develop technologies like automation, IoT, robotics applications to overcome the challenges in terms of manpower and high labor costs.
If automation, IoT, and robotics is the future, then RACE is a launchpad for careers in these high-growth industries. Also known by its full name, the Robotic Automation Center of Excellence is a training academy run by homegrown robotics manufacturer PBA. Its remit is to help old-school engineers make mid-career transitions into the future of the profession.
We started RACE to train engineers with robotic and automation knowledge. They would have been engineers, but at the time when what they learned in school was not so relevant now, right? So we want to make sure that RAISE bring them the relevancy.
One of the other questions that the clients asked was about the position of
Business consultant Eugene Goh is learning how to make robots at RAISE. The impact of the pandemic on the job market forced him to reassess his future.
There are two LiDAR systems. Although I'm 31 and I feel that I'm on track to be obsolete by maybe 35, I do foresee that the industry will move towards automation. In fact, automation will become the norm. So when I decided to switch into robotics, I was taking a step out of my comfort zone. But I decided that it was better for myself if I did it sooner than later. I feel that Singapore's economy will move towards Industry 4.0 and being a smart nation. I saw it that taking the risk now was better if I could be equipped with the right skills, upscaling and rescaling towards this direction.
Future-ready professionals like Eugene are just a small part of the story of how Singapore invented, innovated and improved life during the pandemic. It's a story of how bright minds with bold ideas found inspiration in the midst of a global crisis to build a better, safer, smarter way for a new age.